إلا الله لا إله إلا الله لا إله إلا الله ما لنا رب سواه.
Assalamu alaikum and good morning. MashaAllah, this is I'm really proud of you guys because I don't think I would have gotten up this early. MashaAllah. Considering that you probably had like a long night last night. So MashaAllah, welcome. It's wonderful to be here with all of you. And I hope this is inshallah a helpful conversation. Can I get a sense of how many of you guys are heading into psychiatry? Okay, all right. That's certainly more than when I was in your seats some years ago, considering my own self. And then for those who are not necessarily heading into psychiatry, where is mental health for you guys? Is it like a yes, no, somewhere in the middle? Yeah, just getting a sense. Some of us are a little bit like wavy. Okay, good to know. It's good to know. Just helpful to see like who's in the audience, mashallah. How many of you guys are medical students? Okay, the majority. Any residents? All right, welcome, mashallah. Any attendings? Excellent, mashallah. Alhamdulillah. Great to be here with you guys. Bismillah ar-Rahman ar-Rahim wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. So my topic very generically is called Islam and mental health, or Muslims and mental health. One sec. Thank you, Siri. That's hilarious. Mashallah. And so I thought about, what is it that I could offer in a conversation like this morning? And I think part of it is a little bit of a personal journey, and part of it's a little bit academic, and part of it's where do we go from here as a field? I think that's probably where I'm going to aim for a conversation today. I'm sorry, I don't know if you're sorry or not, that I don't have a PowerPoint presentation, but that's because I was in Minneapolis right before this for the APA, the American Psychological Association, for a couple of presentations at the conference that my students were giving. And our car and all my luggage and laptop got stolen, mashallah. So your du'as, I am laptopless, which makes you feel a little bit naked, but alhamdulillah. So here we are, alhamdulillah. So this is more from the heart, kind of a little bit like last night. I hope that's okay, inshallah. I'll begin the conversation a little bit about me and my own journeys, but quickly segue into the field. I shared a little bit last night how I did not intend to go into psychiatry. It was not my first choice. It wasn't something, honestly, I even considered. Those of you who were around last night know that I went to U of M Ann Arbor for undergrad, and while I was here, did not take a single psychology class. That's how distant I was from the field, and I truly felt that internalized stigma that I grew up with and my entire community had of psychology isn't for us. That's some Western construct that has nothing to do with Muslims. That's who I was. That's how I grew up. Any of you guys similar? Any of you come from similar communities? Things are changing, but there's a couple of nods in the room. So for me, the journey was definitely different. I did not see this coming. When people say, how did you actually end up there? I'll take the shortcut conversation today, but basically it goes a little bit like this. I shared with you that I studied Sharia sciences when I was younger, parallel actually with my high school, college, medical school studies. And it was actually teaching in the community as an ustada, as a sheikha in the community, that ended up leading me to psychiatry. Because in teaching the Islamic sciences and working with people, and having people come to you with their questions, which first sounded like, is this halal, is this haram, is this right, is this wrong, yes, no, I could quote to them what's in the books. But very quickly, it became clear that people are much more complex than the halal and the haram. And there is a lot more layering of people's histories, backgrounds, their traumas, everything that was happening in their lives and their families. And I realized I was way out of my depth in order to really effectively help. Around this period of time, I was in a community, I was a visiting scholar at the time. Before Zaytuna College was a college, it was an institute, and I was visiting at the time. And an incident happened in which I was staying at a house that had previously been occupied by one of the shuyukh. And the student came to the house looking for that sheikh, which, no problem. He was there before, so she's knocking on the door, no problem. But then what happened was a very unfortunate situation where things just got really out of hand. And I did not have the words to explain what was happening, even though I was a medical student and had been studying all kinds of medical terminology. And also, nobody in my community had the knowledge or the know-how to explain what that was either. Today, I can tell you that was called psychosis. It was her first break. None of us knew. Everybody considered it to be some sort of jinn possession, some sort of, read some Quran on her, help her see the sheikh, help her get through this, right? There was no conversation of, take this poor woman to the emergency room. This person needs to go to psychiatric care at all. And for me, that moment, and this is where my husband makes the cameo into the picture, he turned to me and he said, look, I know you want to go into OB. I know you want to help, and you're really passionate about women's health, passionate about women's everything for me, but I was like really passionate about women's health. And he said, look, a lot of really good people can adequately deliver babies, but unless you're grounded in the deen, we're not going to make any headway into the field of mental health. You have both. Try to bring them together. And I was like, you want me to go to psychiatry? The first time I said this to my folks, my mom, who some of you met last night, her first reaction was, you mean you're not going to be a surgeon? You are wasting your medical education. It was just really hard for her generation to really understand psychiatry, to accept it, and to even find a footing or a place into it. So I entered in, kind of last minute, like I told you guys. My letters are rec, still said OB on them. And when I got to psychiatry, the first thing I said to our program director, which is kind of ridiculous, but alhamdulillah, was, I'm only here to help the Muslims. And he was kind of like, well, I hope you'll help everybody while you're here. But I also said to them, I'm highly skeptical of this field. I've kept my distance from this whole psychology thing, and I don't know that this works for my people. But here we are, let's figure this out. And it was an unfolding of a journey over time. And the very first thing that I did, because I had that Sharia kind of training and kind of read the classical books and knew how to do that, is I said, well, what do the Muslims say? What do Muslims have to say about this field? And that started a whole parallel journey for me, along with my residency. So I'm going through the chaos of intern year and chaos of residency, and pulling out, at the same time, a lot of the traditional texts. I'm not telling you all to do that, I'm just telling you my journey, how I ended up where I was. I'm pulling out a lot of these really historical texts. I'm talking about 7th, 8th, 9th century. Yeah, kind of crazy, I'm a little neurotic, but I was pulling out all these different texts from the early period of Islamic understanding, saying to myself, look, we pride ourselves as Muslims for all the advances in medicine, don't we? We pride ourselves in all the advances Muslims made in the sciences, all the advances they made in the humanities. Where is the discussion on psychology and psychiatry? We know the surgery, we know the things that they did in all these other fields of medicine. Where was the conversation on what today we call mental health? So, what I first took out were a lot of the medical books. Your Ibn Sinas and your Razis and all kinds of other authors that I hadn't come across before. And in doing that, it was really amazing because the early Muslims wrote about medicine from the head to the toe. And that's the order they wrote in. So it wasn't very long before I ran into what today you would call psychiatry. And what was really fascinating is that nobody spoke about these things. And I'm not going to give you a boring history lesson, I promise. It actually connects very quickly to like modern clinical understandings in just a moment here. But for me, it was kind of like, why does nobody speak about this? Clearly, there's an entire field that we know called the ilmun nafs, the study of the self, that Muslims were very advanced in. And if you take the word psychology and break it down into its Greek origins, psyche means self, spirit, logia is the study. So they too were doing the study of the self, ilmun nafs. So where did we lose that whole discussion in the process is what I wanted to figure out. One day I ran across this book called, the author was a not known name, now today alhamdulillah known name, but not a known name at the time, somebody by the name of Abu Zayd al-Balkhi. This is the 9th century author. And he writes a book called Masalih al-Abdan wal-Anfus, the sustenance of the body and soul. And that kind of caught my attention. Because this idea of mind-body medicine, you think it's a very new age concept. But here he is writing in the 9th century. And he splits his book into somatic or kind of body-based illnesses. And the second half of his book is all essentially what we call psychiatric conditions. And every chapter, and it reads like chapters, which is fascinating, is what looks like depression, what looks like anxiety, what looks like trauma, what looks like phobias. And then I came to a chapter that looks like today we call OCD, obsessive compulsive disorder. But I had just learned in my psychiatric rotations that OCD is a modern illness. The first case study of it in the 16th century that's documented, and the full conversation of it with all of its symptomology doesn't show up until the 19th century. So they call it a modern psychiatric condition. I just told you Balkhi is in the 9th century. So the backstory is, down the hall from me was the big wig of psychiatry, particularly in OCD, the guy who wrote all the books on OCD, and you can still look him up, in the field of psychiatry. Stanford was one of the first 5 places in the country that actually had an OCD clinic to begin with, and this was the guy who started the clinic. And at the time he was still a professor, now he's emeritus, and it's just, kind of amazing. And so I walk down the hall, still a resident, right? Walk down the hall, knock on his door, and I go, hey, I'm Rania, one of the residents, and I think I found a description of OCD from the 9th century. Now, before you guys all get bored, your eyes start glazing over, look at his reaction. He goes, no. He said, no. He literally starts pulling out papers from his shelf of papers that he's published. He's like, here's what the Greeks said, and here's what the Romans said, and here's what, he's like, all this stuff. He goes, I'm a history buff. There's nobody who wrote about OCD before the 16th century. And then I just sort of was like, Can you read Arabic? And he said, no, can you? I said, yeah. He's like, so you're sure that there's a discussion? I said, yeah, it looks like it. And he said, fine. What most professors do, go translate it and come back and tell me what you found. I was all right. So I go to my office, spend a couple of weeks, kind of translate over this short chapter. And it's fascinating because Al-Balkhi actually gives you essentially the constellation of symptoms of what he considers this illness to be. And then he talks about how you treat it. And both the symptomology, the constellation of symptoms together, to me was fascinating. And I actually pulled out my DSM, which is how we diagnose anything as psychiatrists, and I compared it. And the DSM-5, in 2013 had just been published. And I pulled out the DSM and I compared Balkhi to the DSM, and every symptom that he came up with in OCD matched point by point by point. It's fascinating. I went over to the professor, who you guys have to hear his last name, it's really great, because he's not Muslim, but his last name is Koran. So went to Dr. Quran, that must be some sort of Fal Hassan, like amazing, just, mashallah, we take good signs as we see him as Muslims. Anyway, I went back to him and I was like, here's what I found. And this guy, literally, who was like hand waving me away, right, was kind of like literally jumping. Like he's jumping for joy. It's a big tall guy, and he was like jumping. And I was like, what? And he was like, you have got to publish this. And it wasn't because he was proud of the whole Muslim thing like I was, but for him, it was a scientific thing. Because what this showed, it was a rewriting of the history. It was also a rewriting of the narrative, that psychology was something that the Greeks and Romans spoke about early on, and then nobody touched it or did any advances in it until European medicine. 18th, 19th century, people jumped from the Greeks and Romans straight to Freud. They literally skipped the Muslims altogether. Or when they do mention them, like some of the historians, they basically say all the Muslims did is translate the works of the Greeks and Romans, but they added nothing of their own. There's a specific historian named Barrios that's exactly the line that he writes in his books. So I submitted these papers for publication. I hadn't even thought about publishing. This is actually what started my entire research story, and my entire lab actually started from these early kind of moments. And when we submitted these papers for publication, that first paper on Al-Balkhi and OCD got accepted immediately. And I don't know if you guys have tried peer-reviewed publications just yet, but it's a bear. It takes a very long time to get published, and all the peer review and the back and forth and double-blinded and all the rest of it. And a lot of times you're rejected, and that's part of the story. But this paper got published immediately. It's in the Journal of Affective Disorders if you want to find it. And it's the kind of thing where it's like, they were like, whoa, what is this, right? Something here is happening. So we wrote a second paper on Al-Balkhi and phobias, which is another one of his chapters, and showed essentially the same thing, that he was a millennium earlier, had figured all of this out. Why am I telling you this long story? That paper took a very long time to get published. And that one went through the traditional route of nobody answering us for months, and we were like, this thing's gonna get rejected. But eventually, they said to us, look, we're so delayed because what you're saying essentially rewrites history. And we need historians of medicine to verify your claims. These are big claims. I said, fine, find your historians of medicine. Took a couple more months, they finally found those people. And when we got our reviews back, they said, literally, they called me a he. They assumed everybody, right? It's a guy, but whatever. So, they're like, this author, he, essentially rewrites Barrios. She negates Barrios. And essentially, this discussion now rewrites the conversation on psychiatry, because why do you have people in the 9th century able to figure out a constellation of symptoms and figure out the kind of treatments, which essentially today, does anyone know what the treatment is for OCD? What is our gold standard? Come on, psychiatry folks. What kind of CBT specifically? What kind of CBT? What do you do for folks with OCD or even phobias? Exposure therapy, excellent. So it's a form of a CBT. And the gold standard is exposure therapy and an SSRI. Good, mashallah. So when you get those two, so what did Balkhi write in the 9th century? He literally describes to you exposure therapy. And in his other chapters, and now that there's a translation of his book, he's literally referred to as the first CBT therapist. He tells you how to do talk therapy. Yes, our scholars figured out talk therapy. For all the people who are like, no, we don't do that. It's not part of our tradition. Not only does he describe talk therapy, but he kind of promotes it and he explains how you do this. And more beautifully than that, he tells you, at that time they didn't have obviously SSRIs, but they had herbal concoctions. So he tells you the medications that you need to take. And then thirdly, he tells you the spiritual advice, and he quotes hadith and Quran of how to help you through this issue. And he does that in every one of his chapters. Folks, this was so exciting for me, and I know anybody who's not interested in history might not be very exciting for you, but for me, being able to find these connections to our early sources opened up an entire door for me. It opened up a discussion on why do we as Muslims not understand that this is part of our heritage? This is not just one author or two. And my proof of it is the work that I'm doing now, which essentially is, you could talk about books and people writing theory in books, but did they take it into actual practice? Last week I was in Turkey. I'm doing some field research for a book I'm writing right now on the Maristans. What are the Maristans? Close. They are, you had the second part of it, the hospitals. The Bimaristan, Bimar, and those of you who know Persian or Urdu, you'll know that Bimar is an ill person, a sick person, and Stan is the location or place of. So the Bimaristans in our Islamic history were the place in which a sick person goes for healing, a hospital, basically. In Arabic, we call these Darus Shifa, same concept, the place of healing. And the Muslims didn't just talk about history and theory. They actually took it into practice. This is what we call the proof in the pudding. If you want to know if the Muslims really made excellent advances in the work that they did, take it from theory into practice. So the Bimaristans that I'm studying are ones, and you guys should know this, and if you've heard me speak, I know you've heard this before, but I keep emphasizing it until it becomes something that is solidly understood in Muslim communities. In human history, the first hospitals that have a psychiatric ward are the Bimaristans. There was no civilization before the Muslims that introduced psychiatric treatment in their hospital systems. That's not coincidence. What inspires that? Because is it a Muslim thing? Like, what is that actually made that happen? And do you know what it is? When you look at Al-Balkhi, or even Ibn Sina or Razi, or any of the greats that we've written all these papers on, you'll find that they go back to certain aspects. One of their most famous ones that they quote all the time is this hadith of the Prophet Muhammad sallallahu alaihi wasallam, in which he says, there's a Sahabi or companion that asks him, O Rasulullah, O Prophet of God, shall we be treated basically for our medical conditions? And he says, Ya ibadallah, O servants of God, tadawu, seek out treatment. Because Allah does not send down an illness unless He sends with it a cure. And in some of the narrations, it says a treatment, which as physicians, you know is the case. There are some illnesses that have treatments and other illnesses that have cures. And we have both narrations. This was the impetus that inspired them, that inspired these early people to kind of say, okay, if every illness we see in front of us has some sort of cure, we're not going to ignore any illness, including mental illnesses. And so in their hospitals and in their healing centers, they had sections for those that had serious mental illness, those that had mild and moderate mental illness. The most recent Maristan that I visited just last week, you walk in and there's very characteristic, beautiful things. There's always fountains and greenery in a garden, and there's all these like healing properties. We're writing these papers now on music therapy, that the Muslims were the first, to our knowledge, to use music not for entertainment, but rather for medicinal purposes. The science of the maqam, or the tones, were used that if a person was very anxious, use a tone that calms them down. And if they're very depressed, use tones that bring them up. And people get all agitated about music, and it's like, folks, it's not the music you listen to. This is that makes you insane. No, mashallah. These are tones that they played all throughout these Maristans for healing purposes. And they used Quran and sound therapy to help as well. And they actually had all kinds of other, aroma, we can go into a long time, of all the different senses. It was so holistic, all the different senses they used to heal somebody who had a psychiatric condition. But when you walk into this Maristan, Bayazid, I hope some of you will visit at some point, you walk in, there's this, first you walk through this huge garden, and then there's this beautiful fountain, and then you see the Iwans, the different sections. And it's literally like, here is surgery, and here is ENT, and over here is OB, and over here, and they have different sections. And then you enter the psychiatric section, and it literally has serious psychiatric conditions. I'm not very fond of the wax figures they have there because I took a picture of this. Unfortunately, the people who are currently today putting in like the wax figures as a museum, they have the serious mental illness guy. He's going like this. It's like terrible. Like, what is this? Anyway, mashallah. But they had the traditional folks had the serious mental illness area, and then they had the mild to moderate psychiatric area. And that area was so interesting because you see the wax figures, they're actually making baskets and making rope and whatever. The point is, as they were getting better and healing, before they were fully discharged, they were giving them professions, things to do with their time as they were going through the healing process. You tell me, if you had a community and a society that so heavily stigmatized mental illness, why would you have all of these advances? Why would you have a system that focuses on holistic healing, mind, body, soul? Why would you have a profession that was so forward-thinking? Our most recent paper that just got accepted, alhamdulillah, was on Razi, and his work on the psychiatric institutions, where he, to our knowledge, is the first to introduce something called psychiatric aftercare, which means that after you leave the hospital, he had this tradition, and then it got copied in all the Maristans after him, where he would give money to the patients as they left. 3 gold dinars, which is a lot of money at that period of time. In his writings, he said 2 of them in order to be able to go back into their community with dignity and have a roof over their head. And the 3rd dinar was used to be able to start a business and be able to be self-reliant again after a period of time in the psychiatric institution. That level of forward thinking comes from within the religion. That level of holistic healing is part and parcel of our tradition. But I didn't know any of that starting my residency at all. And it was so healing to be able to discover some of these things. And yes, there is a lot of boring history reading, but to piece together the story and to then revive the tradition is something that I'm very passionate about, because how many of you knew these stories? Anybody? A little bit? Excellent. It's really rare to actually run across Muslims who are like, yeah, the Maristans were our tradition, and yeah, we had a lot of psychiatric care. Mashallah, nothing. Mashallah, most often people do not know this unless they've been hearing it more recently. Now let me switch into the more modern day clinical applications of all of this, because yes, I do have a lab and I do research and I'm a professor and all that good stuff, but I'm also a clinician. I have actual patients, the actual clinics, and I work with Muslims and non-Muslims, and it's really important to me to see this kind of translate over. So what have we been doing? Some of you heard me refer yesterday to the field called Islamic psychology. There's Muslim mental health, and there's Islamic psychology. They're two connected fields, but they're different. Muslim mental health refers to anybody, Muslim or not Muslim, who serves largely Muslim populations in mental health. And that is a field in itself, versus Islamic psychology, which is different. Islamic psychology is starting with Islam. And you start with the frameworks of Islam, and then you build psychology up. As opposed to, so it's a bottom-up approach, as opposed to a top-down approach where you take modern psychology and Arabize or Islamicize the words and try to fit, modern psychology into the cup of Islam. Do you see what I'm saying? Both fields are important, and I do both, because different people want different things. But to me, Islamic psychology is really important. And being able to revive the tradition and understand how do you build from the bottom up. And you can only do that if you've studied and kind of understood and trained in the frameworks of the religion itself. And then you build up what makes sense, as opposed to starting up here and throwing out what doesn't make sense. Does that make sense? Yeah? So this foundation of Islamic psychology, my colleagues and I in the field have started a model. It's called TIP, Traditionally Integrated Islamic Psychotherapy. We just published this book a couple years ago. You can find it on Amazon. It's called Introducing, I don't know. What's the title of my book? I don't know. Introducing Islamic Concepts to Modern Psychology, or something to that effect. And it talks about how you go through these foundational understandings of Islam and put it into modern clinical applications. So if you're a therapist or a psychiatrist that's working in the field, how is it that you work with Muslims who say, I want this from inside of my tradition? Yet we're still working with SSRIs, we're still working with psychiatric care, both inpatient and outpatient. But there's an element of Islam that's strongly integrated into the process. That concept was not existent. One of you earlier, when the questions just this morning said, if I want to do this, if I want to do Islamic psychology one day, how do I do this? I'm so happy to be able to say to you, there are actual programs for it. You can go through the TIP program, our model, where there's trainings every summer in Istanbul, so you get to go to Turkey, which is exciting, until we bring the trainings out here. And it's 4 levels. You actually get trained. If you're a psychiatrist or a psychologist or in training, you're a clinician, you're able to actually go and get these 4 levels. Every level's a year, and eventually you become an Islamic psychologist. Or you can go to Cambridge. I teach at the Cambridge Muslim College, and now we have a diploma in Islamic psychology. We just graduated our first cohort. And it's really exciting to see that there are clinical applications for what was once theory and once kind of like a pie in the sky. Oh, we wish we could have Islam in therapy. And now there's actual clinical implications of how you actually put this into your practice today. Now, I could speak all about that and what you do and how you do, but that's a complicated and long process. But I just want to introduce you to the concepts. And I also want to introduce you to my dream, essentially, before I take your questions, and just say my hope, inshallah ta'ala, and I hope with your du'as, that the concept of that Maristan, which is a holistic healing center, to be able to talk about mind, body, soul, to be able to use all of your senses, it is way beyond allopathic or osteopathic medicine. And I am the most oddball psychiatrist you're going to find, because yes, I do medications, but I do a ton of therapy. I find a lot of healing in therapy. And yes, when I need to prescribe medications, I prescribe medications, sure. But the idea here is that there is so much more than what you're learning in terms of healing. And I say this, and my colleagues don't like it, but whatever. I don't think all the answers are in allopathic medicine or osteopathic medicine. I think there's a lot more out there in terms of how you heal a person in all the different senses, and be able to really find what it is that is very holistic. Because you just giving pills and pushing it, which is what most psychiatrists today do, is not sufficient. And talking and talking and talking through therapy is in itself not sufficient either. There's usually a deep down healing that needs to happen. And yesterday I talked about that we are all wounded healers. We have our own healing to do too. And I also talked about you can only pour out what you contain. So if you're wounded and you have your own spiritual healing to do, or emotional, or cognitive, or behavioral, or physical healing to do, there's only so much healing you can give to the next person over. Which is why I spend so much time, yes, bashing you guys over the head just a little bit about the prayer, okay? But the reality is, it's part and parcel of how you're going to help that person. They don't have to be Muslim. But there's something about that light or that nude as a Muslim that you inherently have, that people are attracted to. They don't know what it's called, and they don't know why, I was one of those people, I'd walk through the hospital and people would just start talking to me, This is before I decided on psychiatry. People just started, and people would say, why do people just open up to you? And I don't know, but there's something in you as a Muslim that just attracts that, and it's called nur. If you pray, if you have that light of God that you can't see but people can feel, it comes through. So tap into that and heal yourself further so that you can heal the people you're working with further as well. Anyway, my dream, and this is how I'll end and take your questions inshallah, is to revive the Maristans. My tagline for this, my lab that's now, I don't know how many years we're in, I think we're about to hit 10. Alhamdulillah. Last year we decided to form a nonprofit because academic work was great, sitting in the ivory tower, whatever. We needed to get out of the ivory tower and actually work with the community and translate what we were publishing academically in these great places, but to the community and educate. And we take on some pretty heavy topics in our lab, like the topic of suicide, but also now the newest line of research is on substance abuse and other mental health kind of conditions and issues that we work with. But how do you translate that into the community? And how do you build institutions of healing that tap into all of the 5 senses? And how do you actually bring in our tradition, not just revive it, but bridge it into modern day clinical applications? So I'm going to ask for your du'as, because one day you're going to have some big paychecks and you're going to come back and invest in Maristan. Inshallah. At least that's my hope. Barakallahu fikum, and inshallah I'll take your questions. All right, folks, how do we do this? Yes, bismillah.
Thank you for your talk. I was wondering, like, as a psychiatrist, like, a lot of times they can say, like, they mainly focus on prescribing medications, but how do you get into the more, like, therapy route, like, in the practice? Like, is there training?
Yeah, in most psychiatry residency programs, you have to actually do some elements of training in therapy. Every program is a little different. Some are much more biologically heavily driven. When I started at Stanford, it was heavily a biological program, very little therapy. But then over time, actually in today, they have a lot more segments on therapy than they did actually when I was in training. So we had an option of doing some extra therapy because we're both psychiatry and behavioral sciences department. So we have psychologists that are through our department as well. And it was an elective. You take the extra electives to take the therapy. I highly recommend doing that. Just because you'll find in the Muslim community, there's a lot of allergies to especially psychiatric medications. And I'll talk about something that's like pretty clear cut, like OCD, for example. I do a lot of work with OCD. And I'll say, look, we can only get so far with exposure therapy, but if you have a moderate to severe level of OCD, you're gonna need SSRIs. And people don't even want to hear that. So I said, sure, no problem. Let's start with therapy and let's see how far we get. And almost always it's the patient themselves that comes back and says, okay, I've been doing this for weeks, I need to get better. And then they say, can I have the pills, right? So, sometimes it's very clear cut. And sometimes all you really need is some therapy. Inshallah, yeah. You tell me, Bassett, where I'm going. Yes, okay.
Hello, assalamu
alaikum salam.
Could you speak on how in a lot of primary care facilities there's an over-pushing of medication as the first line of treatment for a lot of like psychiatric conditions, even though like it might not be diagnosed, it's like, oh, you have anxiety symptoms, we can give you anxiety medication. Could you talk about how that is being overused and maybe how it could change so that like they can address the underlying condition of like underlying cause of what might have caused like anxiety or depression or things like that?
Yeah, in the first place. And folks, we're coming out of inshallah, we're fully coming out of this pandemic, I hope. But, I always say this, like if people did not take mental health seriously, the pandemic made it pretty clear where we're at. And you're right, primary care does. In psychiatry, most fields of medicine do a lot of pill pushing, and it's the easy thing, right? Modern medicine is just, push, 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 right? And pills are the easiest things to do. And when you stand against that, it's a lot harder. But then as I'm very cognizant as a primary care doctor, there isn't the time to do the therapy yourself necessarily, unless you have some, lush private practice or something. But honestly, referral is going to be the key. And your ability to do what I call the warm handoff to psychologists, therapists, or even the psychiatrists that do therapy, the rarities that do that, to be able to have a good relationship with them as a primary care provider and give the warm handoff to your patient makes all the difference in the world, especially in minority communities, especially, I've talked about our various communities that we're part of. A lot of them, this is still very strange, doing therapy. Even though I talked about our heritage and our tradition, and I use that a lot with my patients. I'm like, did you know about Maristan? Mashallah. Did you know about Balkhi? But it's still very hard because it feels like you're airing your dirty laundry, that you shouldn't talk about stuff out of your house, kind of thing. But when you do the warm handoff, especially like, let's say you're a Muslim provider to a Muslim therapist, it is so much more likely that person will actually get that help. And that way you could be there and, as a default if you need to still prescribe the medications if they're warranted, but you're actually truly helping that person, if that makes sense. Yeah. Alaikum salam.
Thank you for your wonderful talk. I found it really interesting when you mentioned the integration of the psychiatric patient when they leave the hospital and how to best assist the patient reintegrate into society without feeling like an outsider or like this psychiatric admission has played a big part in their life.
Right.
And providing those 3 dinars to help them reassimilate back into society and get back on their feet without feeling like a big chunk of their life was missing. I was just wondering if you could maybe touch on, I know the healthcare system is very broken and we've kind of touched on that a lot over this weekend, but with your expertise in the psychiatric field, what are some ways that you found helpful to help your patients reintegrate back into society using the model that you discussed?
Yeah, I know. I wish we had the model we discussed, which is why I really, really want to kind of revive this idea of the Maristan. Just before I answer your question, one quick tangent, because I realized I didn't say this. Not only was there psychiatric aftercare in Razi's model that he actually gave the funds, the actual treatment itself, now you can see how broken our system is. The actual treatment itself was completely free of charge. This was for Muslims, non-Muslims. It didn't matter your background. It didn't matter if you resided there, if you were a traveler to there. Anybody who went through the Maristans, it was free. How was it free? It was free because these were endowments, awqaf. And all of you, I hope, inshallah, that are going into medicine, that when you one day have the funds to put charity into something that's an actual endowment, think of the Maristans, no, but in all reality, people don't think about, they kind of put charity in different places. We think of refugees and wells and water and orphans and all good things, all mentioned in the Quran. But we don't think about wellness. But the early Muslims did. And a lot of wealthy families put their endowments in these hospitals. And so therefore they were a waqf lillahi ta'ala. They were an endowment for Allah until the end of time. And it's beautiful because a lot of them also have these gardens and orchards, and whatever they grew in the orchards they sold, or they had bazaars, and whatever they sold, the revenue came back into the hospitals, and it was self-sustaining. It was a self-sustaining model. It's amazing, mashallah. Anyway, I could talk about that forever. But I say that because the treatment itself was free. And the aftercare gave extra provision. How do you do that in a system like today? Unless we revive the concept of the endowments again, the awqaf. Like yes, they took from zakat money. They actually did use zakat money from Bayt al-Mal, right? Like actual alms charity. But the majority of that funding came from the endowments. So when you ask about how are we going to do this in the modern day when, just insurance is so incredibly expensive, I'm reminded of how the Maristans we visited are essentially as beautiful and amazing as they are. I have to show you some of these pictures. As amazing as they were, that was the equivalent of Medicaid, because that was free of charge. And that was for the most under-resourced patients of the Muslim era, Muslim society, because those who had resources had the doctors coming to their house. These institutions were free of charge because for the folks who were under-resourced. Now imagine that, and they had all of this. So we are so broken and so far away from that situation. Can we revive this? It's true. I mean, where's Dr. Aden? There you are, from the Ummah Clinic. I mean, you are reviving this, right? You're kind of bringing free care to society, to Muslims and non-Muslims, which is the tradition of the Muslims. And the physicians within the Maristan were both Muslim and non-Muslim too, right? Can we revive this tradition? We can. Can you have the concept of the Maristans kind of start again, it's going to be a long way. But I hope you all are hearing this, because there was a day where there was not a thing called Islamic psychology. There was not a thing called, Muslim mental health. And now, subhanAllah, this, decade or two later, we have it. Who's not to say that in a decade or two, we'll have what you're talking about, right? But to answer your question in a more practical manner, how do you help somebody who's been in a psychiatric institution kind of reintegrate back to society? This is where our communities have to have a lot more than forget just therapy centers that are for Muslims, run by Muslims, etc., but actual social services, right? Because that's what the psychiatric aftercare was. I didn't share this too. I hope this is okay to take one more minute and explain this. The other part that I love about the research on the Maristans is to figure out who was doing the actual care. At Stanford Hospital, our team, when we round on the patients every morning, is made up of who? Think about think about the team that you round with. You have your physician, you have your nurse, yeah? Yes? We also round with a pharmacist, right? Who's able, at least in psychiatry, able to kind of figure out all the all the pharmaceutical stuff. We also round with a dietitian, because every patient needs their own specific meal. We also round with a social worker. The social worker helps the affairs of the patient within the hospital, and then helps their discharge into the community, right? And then you can consult, we don't usually round with this person, but you can consult the chaplains for spiritual care. That's the Stanford model, and they're very proud of it. They're very proud of it. When I researched the Maristans, that team, that interdisciplinary team, is exactly who worked in the Maristans. All those disciplines. Because our ilm al-nafs, that field of psychology, was very interdisciplinary, and it had all of the aspects of healing, because you can't pay attention to their care in the hospital but ignore their care out of the hospital. So that's starting to be revived, but I'd like to write a paper that says we did this first, and here's the Islamic understandings of why we did this in the first place. The concept of healing is so important. One more thing about the Maristans, you'll always find them in the center of town. You'll always find them next to either on running water, because they always had fresh water coming in, not only because of our spiritual and religious kind of ritual work of actually cleansing ourselves for prayer, for example, but also because of cleanliness, hygiene in general. And then they also had them in the center of town because of the sunnah of Islam of visiting the ill. If you put your asylums out of sight, out of mind, you're never going to fulfill the Islamic sunnah of visiting the ill. But if you put the Maristan or the hospital in the center of town, and you have to get from point A to point B, and you cross through the center of town, you're more likely to fulfill that sunnah. Everything those early Muslims did was inspired by Islam, because there's no record of any of that with the Greek and Roman traditions that were before them. So this comes from an Islamic perspective, a worldview, and I hope, inshallah, we're able to revive that same thing. Bismillah.
La ilaha illallah, la ilaha illallah, la ilaha illallah, ma lana